when it comes to pharmaceuticals, patents are what pharmacists and the manufacturers use to protect their brand and the drugs that they release. So Pfizer probably has thousands of patents, because for each drug that they manufacture, they need to be able to protect it. If everybody can just manufacture it, then there really is no protection for them at the end of the day. Now, COVID-19 came and it was a novel pandemic. It had never existed before. So therefore, there were no drugs that could be used to cure it. But when we looked to the Western world, AstraZeneca was coming out. There were different creations and inventions and patents that were created. So let me double down a little bit on patents, maybe just for a few minutes too. So when they create those patents, they then give it a name, like a trademark. But I cannot manufacture AstraZeneca, for instance, because it belongs to the manufacturer, who has to hold on to that patent so that they can sell it and then make money.
Even when the ingredients, I'm using the name.
Sure.
No, even when the ingredients
are readily available, right?
Are there, because they don't state there.
Then create yours, create yours. But then that would now be an infringement. It's what they may call reverse engineering, because you have looked at what they used to prepare. You have now prepared something. So those ingredients have existed. Everybody knows where to find them. They're everywhere. But nobody put all of them together to create a product. And as long as you've created that product, then you deserve exclusivity around ownership of that. Biro, what we call Biro, was a patent at one point. But now people call it Biro, but it's a pen. But Biro is now almost synonymous with a pen. So when Biro, because that was the name of the person that created it, when Biro created that pen, he had exclusivity for it until 20 years. When it elapses, it now goes into the public domain. Anybody can now manufacture Biro. So that's how it was. Bluetooth at one point was a patent. So that meant that as long as the manufacturer of Bluetooth had that patent, nobody else could use it without him licensing it. But now, after 20 years, every smartphone has Bluetooth because there's no patent that protects it. So that's how it is with pharmaceuticals too. When somebody creates that drug, there's exclusivity. You can't white label it. You can't make a generic drug out of it. Most of these drugs that we use, Panadol, once upon a time, they were protected by patent. Now, because of what was happening globally, we felt the need to create an awareness in the role that intellectual property can play in allowing people gain access to, these drugs that could save humanity. And so myself and Dr. Tadigwe, we held a webinar that was in June 2021. We invited the then Minister of Health for State, Minister of State for Health, Dr. Mamura, the then Minister of Science, Technology and Innovation, Dr. Tobonaya Donwood as well. They were also part of the guest speakers, and we dealt extensively, on this topic and the role that waivers and compulsory licensing can play with patents. So what then happens, and let me double down a bit with compulsory licensing and waivers, is that even though you have exclusivity over that patent, where there are issues maybe bordering on national emergency, or survival of the world, then you can actually grant a waiver, which means that you will no longer hold on to your patent now. Anybody can now patent, because you see, at one point, at the height of the pandemic, there were probably only maybe 50 million vaccines available. South Africa, for instance, could only get 10 million. I think Nigeria, was it not 3 million they were giving us,
2 point something.
Yes, to vaccinate a country of 200 million people. What a waiver would do is that an organization like NIPRI that is headed by Dr. Adigwe and other smaller manufacturers can roll out these vaccines in their millions, and they can be administered to people. So we don't have to wait for AstraZeneca or Oxford or for some of the other people to say, okay, this country has paid, we're giving them. No. On your own, you can just manufacture, of course, with their approval, and then dispense. So we looked at it and, we discussed that extensively, and then we now moved forward and I said, let's carry out an academic, work on this. Let's interview health practitioners as well and find out what their thoughts are around this sort of arrangement and what it can do to probably save the lives of not just Nigerians but also the health practitioners as well. There is the TRIPS agreement, that is the trade and related aspects of intellectual property law agreement that was signed by countries that are signatories to the World Trade Organization, WTO, where they basically consented and agreed to the issue of compulsory licensing and waivers. You also have the Doha Declaration. Now, we see these more with pharmaceuticals and medicine. Some of the popular waivers we have come across was, I think it was in the early 2000s in Ghana and South Africa. Those were waivers for vaccines for HIV. Because, at the point, South Africa was, I don't know if that has even reduced, but they had one of the highest rates of HIV, and Ghana was coming closely behind them, So having these waivers sort of helps them to get most of the vaccines that they could use to extend the lives of people. So yes, there's the economic side of things, and that is not lost at all. With compulsory licensing, they still gain some economic benefits because it means that compulsory licensing just means you have to license compulsorily, but the other party will still pay a licensing fee. But waiver means that you have waived your patent. And yes, 20 years may not be enough, but the whole essence behind this when it comes to that general, public good is so that people can have the opportunity to live. I mean, if people die, then who's going to buy your product, right?
It's an emergency situation.
It is an emergency situation. So yes, you will definitely lose the economic benefits. What some countries do is because for you to have the waivers, countries need to agree. And the pharmaceutical companies also need to agree. For instance, the United States, I believe, made certain commitments, to make payments to, those pharmaceutical companies so that they still get some benefit out of the waiver. So definitely, they may not recoup that, what they spent. I mean, think about COVID-19. It has come to stay, and anybody who manufactured the vaccine would presume that they will make a lot of money. What we need is, number one, adequate funding, for pharmaceutical agencies. Like NIPRID is doing a good job, they need to be encouraged, and the other agencies as well, and parastatals that deal with research and development, R&D for short, they need to be encouraged. There needs to be an appreciation for what scientists, right, and innovators can do, because if that appreciation is there, then the graduates we are churning out of universities would want to put their time and energy in those sectors. So, I mean, from where I sit, I work with startups and innovators every day. Some of them read law in school, but now they're running fintech companies. Somebody read engineering in school and is running a fintech company. They didn't study any of that in school at all, but because they have seen the opportunities that are there, they've now taken their skill sets, upskilled themselves for those sectors, and they've gone there. So you could have, people coming out of universities who may not even be pharmacists, but they probably read the wider, sciences. Maybe you could have botanists, you could have microbiologists. I've seen somebody who read microbiology working in a bank. He would work in a bank because he doesn't see any need. Who will employ him as a microbiologist in Nigeria? So compulsory licensing and patent waivers can help for access, but in terms of us harnessing the R&D abilities and capabilities we have, we need to go down and be granular on that, and it cuts across all sectors in Nigeria. we don't do active examination of patents. So typically what would happen in the United States or other developed countries is when you have the patent and you take it to the registry, they would examine it and look for the originality behind it. But here they will just say, okay, does it, they will just use their eye and say, does it exist? Does it look like it's new? It's not new, go away. So you have people who have come up with creative inventions, especially in the technology space, who go there and they tell them we cannot register this because it's, you're simply using software and technology to create it. Yes, but the person has created a body of work that did not exist before. You gave an example, Telia, that what about if somebody reads the ingredients and goes and, but you can't do that because somebody else has already done that. Exactly. So if you take that to the patent registry, ideally, that will be rejected because they'll say, no, these ingredients have already been used to create this. But you may be surprised that those same ingredients, you can probably use it to create something else, which you can then protect. So I think a lot needs to be done to, elevate the status of the registry so that they can effectively carry out their work. There are a lot of creative Nigerians, we know that probably 65% of Nigerians are under the age of 30, and so there's a very youthful population. But if they consider that being able to protect their creative works is so stressful and burdensome, then some of them may not even see the need or the value behind it because they will consider that not only am I going to waste my time, but they may probably not register it at the end of the day.